AASIA JANJUA. I'm an internal medicine physician practicing private in Fort Worth, welcoming you to this evening lecture regarding high blood pressure, also known as hypertension. I also have Dr. ZARIN KIDWAI with me. She's also an internal medicine physician practicing at Parkland Hospital, Dallas. Dr. ZARIN KIDWAI will be presenting information on hypertension. It's a series of lectures organized by American Muslim Women Physician Association, AMWPA. It's an organization of Muslim women physicians, dentists, and medical students. It was formally structured in 2008 as a nonprofit 501c3 professional and charitable organizations. The vision of this organization is to promote health, welfare, and education of women. The mission is to improve the condition of women's health, provide a platform for Muslim women in medicine, and raise the awareness of issues regarding community welfare. At the end of the presentation, we will open up our panel for questions. You can also send your questions via Zoom link in chat section, and we will try to address these questions at the end of our presentation. I would like to start our program with the surah from Quran. أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم ويشفي صدور قوم مؤمنين وشفاء لما في الصدور يخرج من بطونها شراب مختلف ألوانه فيه شفاء للناس وننزل من القرآن ما هو شفاء ورحمة للمؤمنين وإذا مرضت فهو يشفين قل هو للذين آمنوا هدى وشفاء صدق الله العظيم. Translation. In the name of Allah, most gracious, most merciful. And God shall heal the breast of the believer, healing for the disease in your heart. There comes from within the bodies of the bee a drink of varying color, wherein is healing for mankind. And we send down in the Quran such things that have healing and mercy for the believer. And when I am ill, it's the God who cures me. And declare, O Muhammad sallallahu alaihi wasallam, that the Quran is the guidance and healing for the believer. After this surah, I would like to move to Dr. ZARIN KIDWAI to start her presentation.
Thank you, Dr. Janjua. Assalamu alaikum. Good evening. It's a pleasure to be here to be able to present to you about high blood pressure. And we're going to discuss today why it's important to know about high blood pressure, whether you have it or not, and why it should be treated. And also I will touch on how to treat it. Next slide, please. So what exactly is blood pressure? Normally, when the heart beats to circulate blood into our circulation, it beats at a certain pressure. And this pressure is what pushes the blood into our blood vessels and reaches the peripheries, our muscles, vital organs, feet, hands, legs, brains, everywhere. Um, it is represented as two numbers, the systolic and the diastolic numbers. You might have heard your doctor tell you your blood pressure is so and so by so and so. That by divides your blood pressure into two numbers, the systolic and the diastolic. In Urdu, sometimes it's called upar ka number ya niche ka number. It doesn't matter. Basically, systolic blood pressure is the higher number. When the heart pushes the blood, that's the systolic. And when the heart relaxes, the blood pressure drops a little bit, and that's your diastolic number. Next slide. So having said about blood pressure, what is hypertension then? Hypertension is basically, in common terms, high blood pressure. Now, there are different peer organizations all over the world, in the US, UK, Europe, India, Pakistan, everywhere, that define blood pressure by different numbers: high blood pressure, low blood pressure, normal. I am going to use American Heart Association and American Cardiology Association's definition today. So by their definition, normal blood pressure is any blood pressure that is less than 120/80. If it is higher than 120/80, that is abnormal. If it's systolic 120 to 130, that's considered a pre-hypertension or elevated blood pressure. Similarly, diastolic of 80 to 90 is considered pre-hypertension. Now, if it goes up more than 130, that is hypertension. 130/90 is considered hypertension. So 130 to 139 systolic, you can see these numbers. Maybe you can take a screenshot of this for your future reference, but suffice it to know that there are different levels of high blood pressure: normal, elevated, stage 1, stage 2. Obviously, normal blood pressure you don't worry about. If it's elevated, that raises your concern. You need to take steps to bring it down. Then, of course, if you reach the stage 1 or stage 2, your doctor will recommend treatment for you. Next slide. So how do we measure the blood pressure? You've seen in your doctor's offices, the nurses bring their big machine, or sometimes they use a manual machine with the cuff around your arm and stethoscope. Most commonly, nowadays we use electronic machines. There are different types, different sizes. The difference is in where the cuff is placed. The standard cuff is to be placed around the arm, the upper arm. And sometimes there are blood pressure machines that place a cuff around the wrist. Those are for home monitors, and yeah, I will come to that in just a little bit. So how should the blood pressure be checked? Person comes into the doctor's office, they're running late for the appointment, they were stuck in traffic, they're anxious and nervous. Well, that's not a good time to check their blood pressure, because the blood pressure is probably going to be elevated. So the person should be relaxed. They should be in a quiet, relaxed environment, ideally. They should be seated. And the arm of the person who you are checking the blood pressure should be resting either on an armrest or on a desk or a table. It's very important to use the appropriate size of the cuff. If the person is of average build, you can use the normal size. For children, there are pediatric cuffs available. People who are overweight or obese, they need to have larger size cuffs to be used. Next slide. So why does anyone get hypertension? It's very difficult to say who will develop hypertension or why someone developed hypertension. Very often we blame it on the family, it runs in your family. Yeah, as you grow older, chances of a person developing hypertension are higher. Certain races, um, then lack of activity, obesity, these factors also contribute to developing hypertension. Too much stress in life, being stressed at work, stressed in family, COVID stress, call it what you will. Stress in any form or shape will increase the blood pressure. Next slide, please. There is also a certain type of people who develop hypertension. Um, these are secondary to some other condition that they might be suffering from. A lot of medications can induce hypertension. One common one that we all know about is steroids. Steroid medications can be life-saving in certain conditions, but they can also raise a person's blood pressure. There are hormone pills used for birth control. Those can also affect the blood pressure. Certain people born with kidney disorders, for example, polycystic kidney and other congenital diseases, or even acquired kidney diseases can lead to hypertension. Narrowing of the artery around the kidney, that can cause it. Certain congenital heart conditions, they can result in a person having hypertension. Endocrine problems, what are normally known as hormonal problems, people with hyperthyroidism may have elevated blood pressure. People who have hypercholesterolemia, I'm sorry, not hypercholesterolemia, sorry, elevated cortisol levels, Cushing's disease or Cushing's syndrome. But don't worry about these names. But regardless, we need to understand that essential hypertension can be because of any condition. It may be just inherent in you, or maybe you suffer from other conditions that can lead to hypertension. Next slide. So why do we focus so much? Why do we need to treat hypertension? Most people have no symptoms from it. Sometimes you go to the doctor's office or you go to get your dental cleaning done, and the dental assistant comes and checks your blood pressure and she says, oh no, your blood pressure is too high. We can't do anything for you. You need to go see a doctor. And you went there for a toothache or something, you're feeling just fine. So we still insist, recommend that the high blood pressure should be treated. The reason for this is very simple. Untreated hypertension can lead to complications. These complications basically are adverse effects that are a result of hypertension that can occur in the future or even in acute setting. Common complications are stroke and heart attack, congestive heart failure. Congestive heart failure is a condition where the heart gets dilated. One can think of the heart as a balloon. And when you blow a balloon, it blows up to a certain level when it's nice and tight and it's floaty and you feel good. This is the right thing. But if you keep blowing it, if you keep increasing the pressure inside, it pops. And when you let out the air, it becomes like a flaccid blag, which you cannot blow again. So the heart is kind of like that. When there is very high blood pressure inside, the heart muscles become weaker. It becomes like a big bag, which does not contract nicely. It starts to fail, and people develop symptoms from it. Uncontrolled hypertension can lead to kidney failure. The most common cause of dialysis in the USA is diabetes. And then second most common is kidney failure from hypertension. Brain hemorrhage. If a person has a sudden rise in their blood pressure, they can have a brain hemorrhage and that can be fatal. Hypertension chronically untreated can also affect the eyes, although that is not so common. Next slide. So how do we treat it? And I'm going to do a little preaching here. I'm sure when you go to a doctor's office, you get told about monitoring your weight, how much exercise are you doing, are you smoking, are you doing this, are you doing that? And over the last several decades, we have realized that inactivity, obesity, or being overweight are linked with so many medical conditions that need to be treated. Hypertension is just one of them. So prevention is the best strategy here. Regular exercise to maintain an ideal body weight. Ideal body weight is measured in relation to a person's height. And this ratio is called BMI, or the body mass index. There are lots of different apps online where you can look up your BMI, put in your height and your weight in pounds or kilos, and it will tell you what your BMI is. Ideal BMI is between 18 and 24. So if you fall above 24, that needs attention. Your diet, especially how much salt is being consumed, that affects your blood pressure. Increased salt in your diet will increase your blood pressure. It increases the fluid load in your body and in your heart. It can lead to congestive heart failure. Now, it's very easy to say that I don't eat much salt. I don't put salt on my food. My wife doesn't add salt in her cooking. I have told her to add less salt. All that is very good. But one thing we don't realize is that salt is actually hidden in a lot of foods that don't even taste salty. So take, for example, the canned vegetables that we buy. They're super easy in the kitchen. They make life so much easier when you have a can of beans sitting in your pantry and you just pop it open, make a stir fry or casserole or whatever. That makes it so much easier, doesn't it? But that is loaded with sodium. Sodium salts are used as preservatives. So when we buy baking mixes, for example, pancake mix or a cake mix, that has sodium bicarbonate in it that is used as baking soda. A slice of bread, just read your nutrition information and see how much your slice of bread contains, how much sodium it has. Because sodium salts are used as preservatives, they are used as baking soda or baking powders. So whenever you're buying processed foods, do get in the habit of reading nutrition information so you know how much sodium you're using. A normal 1800 to 2000 calorie contains, ideally should have no more than 3000 milligram of sodium. And trust me, 3000 milligram is not a lot. It's less than a teaspoon per day. And someone who has hypertension, they should consume less than 2000 milligram of salt or sodium. So that's one thing to remember. Read the nutrition label and read how much sodium it contains. Going on to the next thing that you can do in your lifestyle is work on your sleep. Not many of us can boast of sleeping 8 hours every night. The students are overworked, they have assignments, um, they have to study, homework, all those kind of things. People at work, housewives, they have to take care of their homes, they have to finish up, make sure everybody gets fed. So no one has time to sleep these days. Sleep deprivation affects the heart, it raises the blood pressure. So focus on your sleep-wake cycle. Try to go to bed at the same time every day. allow yourself at least 7 or 8 hours every night. So going to bed at the same time every day and waking at the same time the next morning every day regulates your sleep-wake cycle. It eases the stress on your heart and helps to control your blood pressure. And of course, if you have any underlying conditions that I mentioned before, if your medications need to be reviewed, or if you have kidney problem or other congenital heart diseases, hormonal problems, those things need to be addressed. That is your physician's job. Next slide. There are a whole bunch of medications available these days that can be used to treat hypertension. First step, of course, when you have pre-hypertension or stage 1 hypertension, your doctor will tell you lifestyle improvements. They may recommend medications. And we have any number of groups available. I have listed 5 of the most commonly used groups of medicines here. The first 3 are first line of treatment, are considered first line of treatment. So your doctor may choose to start you on a diuretic. What's a diuretic? Diuretic is a medication that removes extra fluid from your body. By removing extra fluid from the body, it helps to bring your blood pressure down. And they are a very good way of controlling blood pressure. ACE inhibitors or ARBs, some of you who are on blood pressure medications might have heard of these names: lisinopril, valsartan, losartan. These medications come in this group, and they are also first line of medication. The second is calcium blockers, calcium channel blockers. Most common ones that we use are amlodipine, also known as Norvasc, or verapamil. The fourth group is a very common group of medications that is used, but no longer used as the first line, beta blockers. So for example, carvedilol, metoprolol, atenolol, some of you might be familiar with these names. These medications are used more in people who have heart conditions. And then of course, the fifth group, alpha blockers. Medications all have side effects. There is not one medication that does not have a side effect. But having said that, not everybody gets those side effects. Most of these medications have been out there for decades. Hundreds of millions of people have taken these medications and they have proven their safety. Side effects are easily picked up by your primary physician or whoever is treating your hypertension. Regular and frequent checkups with your physicians are important when you're on medication. That is not only to have your blood pressure checked and adjusted, your medications need to be adjusted, but you also need to be examined and have blood tests to catch these side effects. Some of the side effects from these medications can be electrolyte imbalance, sodium, potassium imbalance. Some medications can cause a cough. Some medications cause swelling in your legs and slow heart rate, dizziness, all kinds of side effects. So these will be picked up by your physicians who are treating your hypertension. We have lots of options. If one medication gives you side effects, we can change it to a different one. Some people respond very well with just one medication. Some people need to take more than one medication, a combination of medications. So we have so many options available to us, and really there is no reason why someone should not get their blood pressure under control when they're following with their physician regularly. Next slide. So pretty much all I had to say. And just a reminder, this talk today has been recorded and it will be available to you on amwpa.org. This is our YouTube channel. So when you go on YouTube, type amwpa.org. You will also find our other previous lectures there. If you subscribe, you will, of course, get to see our future videos as well. And our website is a great resource if you're looking for a new provider, if you're looking for new information about vaccinations or our free vaccine drives and things like that. You can always find information on amwpa.org. Do visit these two channels and like and subscribe. I will open this forum now to questions. If you have questions, please enter them in the chat box, and I will hand over to Dr. Janjua. She is going to start the discussion.
Sure. Thank you so much, Dr. KIDWAI, for a beautiful presentation. You pretty much touched all the points, which I'm sure is related more to the hypertension. So the first question came is what type of medications would affect blood pressure and heart rate? So basically, like Dr. KIDWAI said, there's a medication called beta blocker, as well as the other one, which is a calcium channel blocker. So what beta blocker does is we use it for patients who have a fast heart rate as a therapeutic, while if we just use it for blood pressure in certain situations, like Dr. Kedwai said, that we don't use it mainly unless somebody has a heart problem. So beta blocker, which is metoprolol, carvedilol, and propranolol, all these medication, which ends mostly in LOL, like the end part, decreases the heart rate. But if you don't have a cardiac condition, most of the time, if your physician is treating you for beta block with a beta blocker, your heart usually doesn't go down. While on the other side are calcium channel blockers, which are amlodipine, Norvasc, or nifedipine and other, they can cause high heart rate, like a fast heart rate. So sometimes we usually take a complete history before we put patients on any medications. We look at their heart rate. Some people are anxious. Their heart rate is already very high. They have a history of palpitation a lot. And so we usually look into these things and avoid those medications, which can further increase the heart rate. So these are mainly the two medications which will affect your heart. But again, having said that, if your heart is in a good condition and it does not have any problem, and your primary care examines you, listen to your heart, feel your pulse and everything, and do the EKG, which is a reading for your heart, especially we check it. If there is no problem, most of the time these medications are well tolerated with the patient. Next question, Dr. Kedwai, is how often one has to check blood pressure if you are on medication?
Okay, yeah, that's an excellent question, and I get this question often. What I generally recommend to people is initially when you are on a new medication, it makes sense to monitor your blood pressure frequently, maybe twice a day for a few days to see how it is affecting your blood pressure. Once you know that the medication has taken its effect, it is working well, then you don't have to monitor so closely. You can do it maybe a couple of times a week, depending on how your situation is. If you have controlled blood pressure, check maybe once or twice a week at the most. Important thing to remember is that if I recommend that you check your blood pressure at different times of the day. So, for example, when we get up in the morning and check our blood pressure, that's when it is the lowest. And that may be misleading because you see your blood pressure is low and normal and you feel, aha, I'm good. But as the day goes on, you face the daily stresses in life, then you realize that your blood pressure may be going up. So it's a good idea to check your blood pressure at different times of the day.
The other very important thing about the blood pressure is in the studies, it is also seen that the night blood pressure itself causes more cardiac problems in patients compared to the ones who are morning high. So there is a very, very common practice with everybody. Then get up in the morning. I mean, that's like an ideal situation. Get up in the morning, check your blood pressure, take the medicine, and then go on for their work. And a lot of times people don't check their night blood pressure, which is a very, very important factor having a heart problems. So make sure you check your blood pressure at night. There are medication, ACE inhibitors. We usually recommend patients to take that at night, and amlodipine as well, like Dr. KIDWAI said, which is Norvasc, usually cause a little bit of ankle swelling sometimes in patients. So we recommend them if it's little bit, take it at night. And most of the time people do well on it. Dr. Kidwai, there's another question in which they were asking about, if you want, I can take that one. It is, do you have flushing side effect with any of the medications?
Sure, go ahead, Dr.
So
Janjua.
basically the same thing, calcium channel blockers are mainly because you have arteries and you have heart. These are the two mechanisms. So either you control the heart so that your arteries can relax, and it's like a pump and a pipe, like you water the garden. So whenever we use calcium channel blocker, they dilate the arteries so your pressure comes down. As the dilation is happening, there's a little bit of fluid can go out, causes edema, and dilation causes in some patient flushing. Not a very common side effect, but yes, that can cause flushing as well.
And certain medications that are in the group of alpha blockers, doxazocin and prazosin, also clonidine, sometimes affects the blood vessels. Um, but these are
Next,
not commonly used medicines.
sure. Next, it's a question like if diastolic blood pressure, which is the lower part of the blood pressure, is within normal range, like 75 to 80, and systolic blood pressure, which is the top number, is 130, do we need to increase our blood pressure medication?
I'll take that. So
Okay.
once a person is diagnosed as hypertension, then the goal of treatment is to keep the blood pressure under 140 over 90. This is when a person has just essential hypertension. But if they have other comorbidities like diabetes, then the goal is different. Then we recommend keeping the systolic under 130. Dr. Janjua, you want to take the next question about structural heart issues?
Okay.
Okay.
Which structural heart disease issues and arrhythmia? So arrhythmia is a term which is like an irregular heart rate. Somebody's asking, so which structural heart disease issues and arrhythmias can cause hypertension? Again, mainly depend. It's like we are going really, really back into the pediatric department. So when your heart has like different, like people are born with anomalies, like abnormal heart shapes, or they are born with some arteries. Like I'm still talking about the heart and the arterial system. So that is like your aorta, which is coming out from the heart, is blocked, like a little bit. We call it coarctation of aorta and all these things. Usually you can have blood pressure problem, but two different ways. So that's more in a pediatric department. In adults, basically arrhythmias, if your blood pressure is higher, if you look at the same concept, that if the pressure is higher, it will cause back pressure to the heart. I will not say that high blood pressure all the time causes a lot of arrhythmias, but that it can lead to different arrhythmias as well, which is sometimes people can go into not atrial fibrillation, but sometimes rapid, ventricular rate will start, the heart will start beating too fast. And if they have some kind of a structural heart disease, which was perfectly quiet, sitting in the heart, not doing anything, and as you raise the pressure, it's going to go ahead and cause the problem. basically that. But mostly the pediatric is like the kids, they come with other heart problems, can have in the long term high blood pressure. But then there are more factors other than just sole high blood pressure. You have high cholesterol, kidney problems, and all that, and this leads to it. And the next question is, what's flushing? So flushing is basically you feel like your cheeks are red, or you feel like you're hot, like you run, you exercise, and you feel like the blood is flowing on the face. There are certain diseases which causes flushing. So flushing, that's what flushing is. Like you're sitting and all of a sudden you feel, but don't confuse that with menopausal symptoms. So it's just like you start the medication and this start to happen most of the time when people, maybe it's happening because of the medication. So please always call your doctor and ask them, this is what started since I started medication, or even you are on medication for some times and you start having these symptoms. Talk to them. They know your complete history and they will tell you, no, this is not because of this medication, this, you're going through something else, some kind of other joint diseases or some other problems. So they can look into it. So please do not stop your medications. Always talk to your doctors. Internet is a very good source, but a lot of times that internet is written by like not people who don't know much medicine, so they always put things, and by looking at these things, people assume that this is the same problem they are having. So always talk to your doctors before you stop any medication. That's very important. And please check your blood pressure morning and evening if possible, which is really an ideal situation. And once it is settled down with your medications, once you are on it, then you can check sometimes in the morning and sometimes at night. That is fine. And any symptoms, any problem, please talk to your doctor. Sometimes it's written in the paper which you get when you pick your medications from the pharmacy. There's a whole bunch of paper. Everybody starts reading that, and they start to go back to the internet and they start doing things, and then they stop the medication. By the time their follow-up is, usually they are not on medication. The follow-up recommendation with medication is at least 4 to 6 weeks, but you keep checking your blood pressure. And if there's any problem, your doctor recommends you to please call them, because you don't have time. It's a silent killer. Nobody knows about high blood pressure, what's happening. So a lot of people come, their blood pressure is high, like Dr. Kidwai said, dentist office, health fair, and they say, oh, nothing is happening to me. Believe me, nothing is going to happen to you. And boom, heart attack comes, and stroke comes, and then those people regret that. So it's better prevention, like Dr. Kidwai said, lifestyle modification, caffeine cut back, sodas cut back. I mean, all these things are really harmful. And sometimes people are born with genetic tendency to have these problems, but their health is so good, they do well. But some people just adapt it with their lifestyle. So yes, weight loss helps, but it's not like, people say, I'm going to lose weight, so I'm not going to be on medication. I always tell them, when you lose weight, we can always cut back. But right now you're 150 over 90, and you will go into a heart problem where your heart will get bigger, and that is not good. So please always talk to your doctors about all your medical illnesses.
One thing I want to stress is that hypertension is a progressive disease, which means that over time, the hypertension increases. So, a medication that was enough for you in the beginning may not be sufficient over time. Maybe you need additional medication. So, don't let that discourage you if your doctor tells you one medicine is not enough, or we need to give you more, or increase the dose, and things like that. So, stay connected with your physicians, go for regular checkups, let them decide what medications you need. And before you accept a new medication from your physician, please ask them what are the side effects, what you should look out for, and is there an alternative? If the side effect is not acceptable to you, have a frank conversation with your physician. Tell them, doc, I don't like the swelling that this is causing. Is there some other medication I can take? Or this medication makes me use the bathroom too often. Is there something different that we can do? Have a frank conversation.
The other question is what type of exercise um, do you, let me read it. What's the exercise recommendation for blood pressure? So
Okay.
basically, there's no exercise prescription for any adults. So basically, we always tell them, please moderate intensity physical activity, approximately 30 minutes per day, 5 or more days a week, or 75 minutes of intense exercise, which is again 30 minutes per day for 3 days. So there are different things. Aerobic exercise also helps. Relaxing exercise also helps, right? Dr. Kidwai said sleep is a very important factor. Anxiety, depression, all these things lead to high blood pressure as well. Some people just keep things in, they keep working, keep eating junk food, not sleeping at night, and the blood pressure is high. Relaxation exercise also helps. Calm down, walk for 30 minutes with nobody, no phones, nothing, just relax and give your body. So a lot, I mean, those exercises can help as well.
So I see a question here about if the blood pressure medication is working, does it need to be changed periodically?
Mhm.
If the medication is working and if you do not have side effects, then there is no need to change it. Continue the same medication.
I think it's stressing more and more on taking care of yourself. At least if you have insurance or if you don't have insurance, at least see a doctor one time. Get yourself, AMWPA does, I mean, right just now because of COVID, we are not doing a health fair, but there were a lot of free health fairs where people come in, we check their blood pressure, we tell them you have high blood pressure, and then you can go to a different pharmacy or any friends, you go just check your blood pressure randomly and see. If you see that the blood pressure is higher, then it needs to be monitored, it needs to be treated. Again, I'm stressing a lot, it is a silent killer. You will not know. Some people may have headache, they end up get to the ER, check their blood pressure is too high. Some people end up in stroke in the ER. Some people end up with a heart attack in the ER, and they always say that, oh, this is the first time I found out, then I have high blood pressure, but they never ever got themselves checked. And it's so important to drop everything and take care of yourself, especially mothers and daughters and people who are actually, and also fathers who are working day and night to help their family, raise their family, but they don't have time for themselves, not even an hour. This is it's a big burden on the family if one person gets sick and God forbid this happens. So please take it very seriously. It's like every day, it's like so much, it's almost 50%. I mean, adult popul. I mean, you will see high blood pressure everywhere, and the ones who are not hypertensive, I mean, they don't check their blood pressure. So seriously think that we have so much going on in the community, and especially with this food, especially with this sitting, no exercises. So everybody has time to watch the whole game, but nobody will get up and do the exercise, and that's the major factor. Um, there is another question which says, um, is the caffeine, what's a
Safe
safe
caffeine intake.
caffeine intake?
I don't think there is any recommendation as to how much is safe.
Is it, mhm.
Certain drinks are more caffeinated than some others. So use moderation. If you're drinking 1 or 2 cups of tea a day and you don't have any issues with your blood pressure or your heart, you're good. Some people who have congestive heart failure or who have rapid heart rate, we tell them to reduce their caffeine intake. Uh, tell them, if they are drinking 2 large cups of coffee or, taking Red Bull and things like that, which are highly caffeinated drinks, then I would like to tell them to reduce their intake of caffeine. But 1 or 2 cups of tea or small cups of coffee is all right. That's fine. Um,
So there was
again,
somebody asked about arrhythmia. So there are studies in which it showed that caffeine is also arrhythmogenic, has arrhythmogenesis. Like if you keep drinking coffee for a long time, you are at high risk to have arrhythmias, which is like up to, I think, 400 milligrams per day. It's like 4 to 5 cups of coffee. So a lot of times they don't, it's not like they're provoking it, but you are going towards that. So there was a study one time about caffeine and arrhythmias as well.
caffeine also causes insomnia. So that night cup of tea, if you're
Yeah.
an insomnia sufferer, that tea after dinner may not be such a good idea. Think about it.
Yeah, green tea is good if somebody wants to have something like afterwards. That, I mean, if you really like to drink something like sweet, do that one. Um,
Yeah.
put some honey in it if you're not diabetic. So basically, just a good lifestyle modification. When we are young, we are running around doing all this stuff, burning everything. And then later on, I think we get most of the people are busy. They may be CEOs of the company, they may be one of the big doctors as well. But when it comes to take care of your health, I feel like education does make a difference, but sometimes I have seen patients who never went to school, but they are so good. They literally bring the papers with their blood pressure reading to know. And there are patients who don't. So I think the main aim is to take good care of yourself before it is too late. So that's what this is what we always teach is prevention before it comes to you, because once blood pressure is there, it's there unless you lose so many pounds. Anything else, Dr. Kava, you want to add?
I don't see any more question in the chat box. I guess we have answered everyone's questions.
Okay.
Thank you so much, Dr. Janjua, for getting us together. And thank you
My
to
pleasure.
AMWPA for creating this platform for education of our community. And Dr. Janjua, do you have something to say?
No, just to tell patients and awareness and about this organization that this is this organization is very devoted, and the physician in it are mainly volunteers, and they take time out to do these presentation, and the only aim is to spread the word among women as well as anyone in the community. It doesn't matter they're Muslim, non-Muslim. It's a universal message for everybody is to do prevention. That's their main goal, and this is how we have achieved a lot of success in patient addressing problems in our healthcare. We literally had to send patients to different charity clinics so they can take good care of themselves. So please do visit this website and support this mission. And whatever you can do, if you're hearing all this stuff, taking the notes, spread it to your family. Tell your father, mother, brother, whoever. Please spread this word, and it's going to save the whole family. And that's it. Thank you so much.
Thank you, everyone, for joining us.
Thank you.
Assalamu alaikum.
Assalamu alaikum. Thank you.